We've had to worry about COVID each of the past two holiday seasons. This year, we're adding in two more viruses, the flu and RSV. Many of us gathered with friends and family to celebrate over Thanksgiving this past weekend. Maybe you picked up a virus from them. We're going to talk about what you should do now. To answer your questions, we've got Dr. Amy Thompson, clinical coordinator with Alamance Regional Medical Center Pharmacy. She's going to break down all those virus concerns and help us work through the respiratory virus season start to finish. First off, how concerned should we be if we spent time with other people over the holiday?
Yeah, it can be really scary if you found out that you were exposed to COVID when you were trying to enjoy your holiday. There are especially people that are concerned because they have a higher risk of getting very sick if they get COVID. So that could be people with certain health conditions, but really one of the most common risk factors for having a severe kind of COVID illness is just your age. So people that are over 50 years old have an increased risk of getting really sick from COVID. So I think that's why it's important to really take things seriously and kind of follow recommendations. If you find out that someone you've spent time with over the holidays or over Thanksgiving now has COVID.
So what are those recommendations? Do we need to quarantine now?
So starting precautions should be your first step. So those precautions would be things you probably have heard before: wearing a mask, quarantining yourself or isolating from other people, and consider getting a COVID test. Even if you don't really feel sick, you should wear a well-fitting, high-quality mask as soon as you find out that you were exposed to COVID. So an N95 will give you a high level of protection. A disposable surgical mask, like the one that I have, is better than a cloth mask, but really the best type of mask is the one that you will actually wear. And you should wear that mask the right way, so don't let it kind of fall under your nose. Don't have it hanging off of your chin. You should wear that mask for the right way for at least 10 days, because you can still develop COVID 10 days after you've been exposed. Quarantining yourself, again, is another thing that most people have heard of. Regardless of whether you have symptoms or not, the current recommendation is that you should stay at home and isolate from other people for at least 5 days. And if you are having symptoms, they're not getting any better, you're probably going to have to stay home longer.
And the mask is just wearing it when you're out and about. You don't have to wear it with your other family members?
You should still be wearing it when you are at home with your other family members, especially if they do not have any symptoms or you think that maybe they haven't been exposed. So it's kind of a pain having to wear a mask in your house, but it's really doing it for the people that you love, trying to prevent them from getting the COVID that you may have been exposed to.
You mentioned testing. How far after the exposure will it show up on testing?
So if you don't really have any symptoms, it can kind of be hard to determine if you have COVID based off of just a home test. Like home tests aren't really necessarily as great as maybe doing a test in a lab for detecting COVID for people that don't have symptoms. But if you have, even if you don't have symptoms at all, you should probably get a COVID test 5 days out. If you don't have any symptoms, waiting that 5 days can help to make it more easy for the test to detect whether you have COVID or not.
A lot of people have not gotten a COVID test in so long. Are they still free if you do the lab version?
So it would kind of depend on where you go, but you should be able to get a COVID test for free. And I kind of mentioned the home tests. That would be a good place to start, and people are able to get home tests for free also.
And how far after exposure do the symptoms start to show up?
So some people never get any symptoms at all. That would be asymptomatic, but usually if people are going to have symptoms, they'll be getting them anywhere from 2 to 5 days after they've been infected with COVID. So you could be infected with COVID and still spread it for like 2 days before symptoms even start. So that's kind of one of the reasons why it's so important that if you find out you've had an exposure to COVID, that you start taking these precautions now.
So if you start to get sick, do you call everyone before you get your test back and warn them, or do you wait for the test so you don't panic people?
So anytime that you feel like you are starting to get sick, you should quarantine yourself from others, get a COVID test, and then really you need to tell people that you were around. So your loved ones, your coworkers, you really need to tell them what the results of that test were, or that they could potentially have been exposed to COVID. Can be kind of embarrassing. Maybe you don't want to really kind of just tell them, but really that's how they will know to start taking precautions. And it's really a great way that we have to be able to reduce the spread of COVID, especially when people are really close together during the holiday season.
Look, all these people you gather with are people you care about anyway, so you should let
Yeah.
them know for sure. So how do you know if it's the flu or COVID or RSVs in the mix now too? What's the differences between all of these?
That is a really great question. So, COVID, flu or influenza, and RSV are all caused by different viruses, but they really all share kind of similar symptoms. So, because the symptoms are really essentially the same or very, very similar, you would not be able to tell what is making you sick just based off of your symptoms alone. People can even have multiple viruses all at the same time. So, the only way that you would know what's making you feel sick is to go and get tested. If you also go and get tested, your doctor or your other healthcare provider that you go to would really know the best way to be able to treat your symptoms based off of that instead of kind of just guessing.
Speaking of treatment, at what point do you go in for treatment if you do get sick?
So, some people may never feel sick, or they may kind of have mild symptoms and just choose to quarantine at home, wear a mask, and not really go in to see their doctor. If you have any kind of health condition that really puts you at a high risk of getting very sick from COVID, so that would be some immunocompromising conditions, some medications that you might take, or again, if you're over 50, or I would really encourage you to get tested right away and to call your doctor or your other healthcare provider soon after if you get a positive COVID test. Even if you don't really have any symptoms right now, or you have kind of relatively mild symptoms, there are some COVID treatments that the doctor or healthcare provider can prescribe to you that can reduce your chances of developing those really severe symptoms. But those treatments really have to be started early in order to work. So even if you don't really feel sick right now, if you're in kind of that higher risk group, you should go ahead and contact your doctor. But no matter what is causing your symptoms, you need to call your doctor or seek kind of emergency care if you have some really, really severe symptoms or ones that are just really, really concerning to you. So that could be things like chest pain or pressure that doesn't go away, or if you are really unable to stay awake or you're just really confused and that's kind of not normal for you.
What about fever? If your fever gets to what point do you need treatment?
So we would say that you would have a fever if it's 100.4. But even if you have a fever, it doesn't necessarily mean that you have to seek treatment. It's just if you kind of have that higher level of risk, or if you're really, really not feeling well. Regardless of whether you have symptoms or not, kind of isolation is where you need to go. And having the treatment would be determined by what your risk factor is for getting really severe COVID, or if you're just not really feeling well and you want to get some help for your symptoms.